Young mothers can now smile once again after being given an opportunity to reunite with their family members. At Mama Lucy Kibaki Hospital, several young mothers, many under the age of 18, were recently freed from hospital detention after well-wishers stepped in to settle outstanding medical bills.
My name is Dr. Kemunto. I'm the chair of the board of this hospital. Today we are really happy and excited and very grateful because of what has happened today. We have received guests that have done something that you would want everybody else to do to provide support to Mama Lucy Kibaki Hospital. They have come and paid hospital bills for teenage mothers. And these teenage mothers are 16 years old, 17, 19, 18. They have babies, but they do not have a way to get back home because the bill has accumulated and they can't afford to pay.
Along with clearing the arrears, the donors provided essential gifts to support both the mothers and their newborns post-delivery, offering relief and renewed hope to these vulnerable women.
Kwa majina naitwa Ann Muthoni. Niliadmitiwa hapa Mama Lucy Kibaki Hospital on date 3 mwezi wa 7 na nikadischargiwa date 21 mwezi wa 7. So nimekaa almost 1 week nikiwa discharge, sina bill, ikakuwa ngori hizo vitu zote, but watu wa Reconnect wamekuja, wametulipia bill, wametupe mazawadi. We are so happy, na ningewaomba hao wenye hizo vitu kwenye zimetoka wabarikiwe sana, na pia watu huko nje wenye mnasaidia hao watu wa Reconnect, tungewaomba muendelee pia hivyo hivyo, juu bado kuko na watu bado the same case wako nayo, so tungewaomba muwasaidie pia wao waweze kutusaidia.
Kwa majina naitwa Lisoithera na nashukuru Reconnect kutusaidia kutoka huku juu wametuletea gifts na wametufanyia kitu kubwa sana yenye hatukuwa tuna imagine, hatukuwa tuna expect. Lakini kwa nguvu za Mungu tuko nadhani tutalala huku, lakini hatutalala.
My name is William Onyango. I'm the regional manager in charge of Hali here in Nairobi. So today we are here at Mama Lucy. We've come to give back to the society. Today as a company, we decided to practice corporate social responsibility, where we've been here, we've discharged a number of patients. Our company is called Hali Connect. What we do, we actually link the sellers and the buyers on our platform. So the reason why we came here today, we felt like community is part of us and we are part of this community.
The hospital's leadership, led by Dorcas Kemunto, who is the board chair at Mama Lucy Kibaki Hospital, highlights that the situation seen at Mama Lucy Kibaki is just a fraction of a larger persistent challenge.
Please remember, the kind of patients we receive here live below $1 a day. And so you can imagine a hospital bill if they are not covered under SHA. Now, where they are under 18, they cannot be registered for SHA. So that compounds the problem. But when you receive guests that are able to pay their bill and bring other goodies, they brought them other merchandise that they are going home with, a basin to wash a baby, a beautiful towel, a baby bottle to feed the baby, Pampers, to take care of the baby. The mother's happy. Of course, we have cut a cake that makes it much more sweeter. So Mama Lucy Kibaki Hospital, sometimes we struggle with the resources that we have so that we are not able to waive the bills for everybody. But when we speak to partners that have a willing heart, that are kind, that are philanthropic, they come and pay off these bills. There's no better joy for this hospital than that. And this is through the board of management that we got these guests. And now our hospital management has participated in this activity because they are the ones who provide this support. So we are very grateful.
Meanwhile, the Ministry of Health, together with Nairobi County authorities, are engaged in ongoing efforts to improve maternal health services and financial protection. However, the exclusion of minors from health insurance coverage limits the effectiveness of these initiatives and leaves young mothers particularly vulnerable to hospital detention and its negative consequences.
And therefore, these 5 mothers are going home to their families to reunite with their families and going home with their little babies. Please remember, they are teenagers. They can only be given support because that's the only way they can be able to go back home. But also because SHA can only register somebody who has a national ID, it is a time for an option to be provided to take care of teenage mothers that do not yet have an ID card. Because now we realize the system is that way. I think this is the feedback that SHA can also be able to work on, so that teenage mothers also can be able to register for SHA, and so they can be able to be taken care of that way, because we continue to have them here in Mama Lucy Kibaki, and we deliver them safely, and they go back home safely. We also ask for other people of goodwill to come in, because they were not only 5, they're actually 30 that have been discharged, but they are still around the wards because they can't be able to pay. We do waive fees, but we can't waive for everybody. We also need the monies to take care of the expenses in the hospital, medications, and others consumables that they use to treat patients at the hospital. And so anybody of goodwill that would like to come forward and really help these other 30 mothers that have remained would be most grateful.
I'm happy kwa leo nienda home kupatana na familia yangu. Ni furaha kubwa. I don't imagine today nienda kwa ile bed niliacha. So I'm happy. Yeah.
Keep it with Pebeto News.